national restrictions in England will come to an end. And subject to the vote in Parliament, we'll return to the tiered system from Wednesday morning. I know that the national restrictions have been really tough for some people, but the good news is they've been working. Let me take a moment, if I may, to run through some of the numbers. Today's study from Imperial College shows that the national restrictions have brought down cases by a third. Over the last week, the average number of positive tests is now 14,778, down from a peak of 25,331 on the 16th of November. Today, there are 15,712 patients in hospital right across the UK with coronavirus. That is down from 16,612 on the 23rd of November, a week ago. In England, in the week before the peak, the number of cases grew by 11%, but in the last week, cases have dropped by 30%, almost a third. This is clearly good news. It shows that the national restrictions have been successful. And what this means in practice is that through everyone's actions in respecting the national lockdown and through everything that people have sacrificed, we've reduced pressures on the NHS, we've brought down the number of coronavirus cases, we've got this virus back under control. And I want to thank you for that and for the part that you've played. The effect of the action that we take, of course, brings with it huge challenges too, especially for the hospitality sector. And as the analysis of health, economic and social effects of COVID-19 and the approach to tiering shows, which we've published today, it clearly demonstrates this action is necessary to avoid a much worse outcome. And we must be vigilant. There are still 14,778 positive cases reported every day, and there are still those 15,712 people in hospital with COVID. And sadly, there are still 460 reported deaths on average each day. This is far too many. But there is light at the end of the tunnel. We know that together we can beat this, and we've got to stick at it. Putting this in technical terms, the R rate is back below 1, but only just. When R is below 1, the number of infections falls over time because on average, each infected person infects fewer than one other. And for that to happen on average, it's important that lots of infected people infect no one else at all. This is the central challenge of this pandemic, and it's made much, much more difficult because about 1 in 3 people with coronavirus have no symptoms at all. But nevertheless, they pass the infection on to others. And that is why, even as we ease these national restrictions, we've got to keep some restrictions in place, and hence the tiering system. So while we can let up a little, we can't afford to let up a lot. The success of our collective efforts means that from Wednesday, everyone in England, even those in Tier 3, can have some greater freedoms. But we don't have much headroom. We can't risk letting cases rise again, especially into Christmas and with the flu season round the corner. The Prime Minister has published the government's COVID winter plan, which sets out the end to national restrictions and the steps that we'll take to help to bring life back to normal by spring. But even as we take those steps forward, we must keep our resolve. We've worked so hard and collectively sacrificed so much. But we can get through this, and I know that hope is on the horizon. In the past fortnight, we've made some really significant progress on vaccines, and the NHS now stands ready to deploy a vaccine should one be approved by the UK's independent regulator. Today, Moderna, the American company, formally filed for its vaccine in America. Moderna has already been submitting data to the MHRA, the UK's regulator, for some time. And as we set out this weekend, we've secured 2 million further doses, meaning that we in the UK now have access to a total of 357 million doses of 7 different vaccines. And while we keep working on a vaccine, we've already built a huge testing capacity that we can deploy right now. And I wanted to take a moment to talk through the next steps on testing. Since the start of the pandemic, we've built the biggest testing capacity in Europe, and it means we can use tests to do lots of things that we couldn't do before. In addition to our symptomatic testing programme and the rapid testing that we're now deploying in the NHS and across social care, we have the capacity to do more. Today, we begin the rollout of our university student testing programme and expand community testing. And we won't just test people with symptoms. Because of this problem of asymptomatic transmission, people who don't have symptoms but do have COVID, transmitting COVID to others, we're going to test people who don't have symptoms as well. This really matters because by finding the positives, we can break the chain of transmission and stop other people catching COVID. In Liverpool, where over 300,000 people, both those with symptoms and those without, where that testing has happened, they've managed to bring the case rates down by over 3/4. And so on Wednesday, Liverpool will go into tier 2, not tier 3. Of course, I want to see this sort of success right across the board. So we're rolling out community testing much more widely. We've been working with those going into tier 3 with colleagues from Scotland, Wales and Northern Ireland too. And today, with the publication of our community testing prospectus, we set out the next phase of that work to give tier 3 areas a faster way out of the toughest restrictions, to support them to come down the tiers as has happened in Liverpool. We've already received significant interest from around the country, including from the West Midlands, Redcar, Warwickshire and Medway and others. And this offer is available all across the UK and will be delivered in partnership with local authorities in tier 3 areas and with devolved administrations throughout the country. Because by using tests that can turn results around in under 30 minutes, we can identify and then isolate people who have COVID, including, crucially, the about 1 in 3 people with COVID who don't have those symptoms at all, but can nevertheless pass the infection on. Because if you have COVID without symptoms and still infect others, that, of course, is a silent danger. You wouldn't know that you're risking lives around you. And so, to anybody, if you're offered a test, please take it. You might just save a life. The final thing I wanted to say is that it is all of our responsibility to keep ourselves safe, to keep our families, our friends, and our communities safe. That responsibility is on all of us. And I know that it weighs heavily. We've been carrying it for a long time now. But the light of dawn is on the horizon. It's the moment to stand firm until the morning. So we can look back and see clearly that everything we gave and everything we did, it was not for nothing, but so we could save lives and build back better